Hello everyone. Many thanks to the Faculty of Public Health for inviting me to get involved with their European Public Health Week activities. I'd like to share my thoughts on today's theme, which is leaving no one behind, and I've chosen to reflect upon this within the space of tackling inequalities to better the nation's health. Even before COVID-19, the impact of inequalities on health was clear. In the UK, affluent people enjoy 19 more years in good health. In fact, Public Health England data has shown that people living in the most deprived areas spend nearly a third of their lives in poor health, compared with only a sixth for those in the least deprived areas. The effects of the coronavirus pandemic have mirrored and in some cases exacerbated existing health and social inequalities. COVID-19 has had a disproportionate effect on the most disadvantaged in our society. There's consistent evidence that mortality rates for deaths associated with COVID-19 during the first wave of the pandemic were more than twice as high among the most deprived. And irrespective of deprivation, among those under 75, the pandemic has disproportionately impacted upon ethnic minority groups. We must also acknowledge the impact of mitigation measures such as lockdowns on local economies and the risk that poorer areas and communities may become poorer still. Through our battle against COVID-19 right across Europe, we've seen clearly that it's crucial for national, regional and local partners to be able to work well together. That's why one of the key aims for the UK Health Security Agency is to continue with a local-first approach. In England, we will work closely with communities, councils and local directors of public health and our devolved administrations at every step. Our aim is to curate the data and enable integrated, efficient, innovative and safe information sharing across the public health ecosystem and bring together analytical and health expertise. We will have a strong focus on understanding and reducing inequalities, targeting action towards groups disproportionately affected by infectious disease, from environmental hazards and other external threats. In the UK Health Security Agency, we will be looking to invest in the expertise, infrastructure and capabilities we need to be better prepared for a wide range of potential future threats and support equality of health outcomes. Many factors vital to good physical and mental health are the responsibility of partners beyond the health service, such as work, education and transport, housing and air quality. And that's why if we're to tackle inequality and build back fairer after the pandemic, we must all continue to collaborate and build bridges between global and national, regional and local, public and private. We must bring science, research and policy closer than ever, with joined up action across partners to address existing and future public health challenges. And as Chief Executive of the UK Health Security Agency, I'm going to be working passionately with public health colleagues across the globe to ensure that when the next health threat hits, where you are born does not predetermine your outcome.